I like being a GP very much. I still enjoy my job after 23 years.
You can do a bit of everything. There is that variation, and that's what keeps the job exciting.
So you never know what's coming in next. You never know what your next patient's going to be. It can be anything and everything, and I love that.
You have to be a master of all trades. There's never a dull day, never a dull moment.
We are specialist generalists. We are consultant generalists, and that's what I really enjoy.
It's a real privilege to be a GP and be in that position, and to make a difference when a difference is needed at people's various points in their life.
I really enjoy the clinical work as a GP because I like seeing people, I like talking to people. You see patients right from being very little to growing up to being very old, so you get to know them well.
My other role is that I'm the lead training programme director for GP training in North Cumbria. It's 3 years, and we place doctors in training into general practices throughout North Cumbria. So we mentor them the whole way through that 3 years.
I'm a third year GP trainee, so I'm currently working in a GP practice 2 days a week, and I'm 2 days a week in a sexual health clinic, so I get a sort of mixed role, basically learning to do the job of a GP. So clinics, triage, meds requests, basically everything that a GP does.
So a GP partner is very much being a GP within a practice, staying within a practice, being committed to that practice as a GP, but also as a partner. So you're very involved with the business side of the practice, how the business runs.
I think because I've been here such a long time, I feel like this is working for a family.
I came to North Cumbria for the work-life balance, and that's the other thing GP gives you, is that you don't have to work in a hospital, you don't have to work in a big city. You can live out here in the hills and still do an amazing job.
Cumbria is a brilliant place to live. It's a brilliant place to explore the mountains for walking, running, if you like, activity, or even just exploring. And you're also not too far away from any of the big cities if you wanted to go and explore places like Newcastle or Manchester, Glasgow, Edinburgh.
I have made, a home here, a family here. My parents actually moved down from Scotland to be here because they liked it so much. The opportunities for every outdoor activity imaginable, great schools, and lovely scenery.
It's a fascinating role, and I'd encourage anybody to think about general practice once they become a doctor and start thinking which speciality they want to get into.
I'm not going to lie, it's hard work to become a doctor, but the rewards are worth it, particularly working somewhere as amazing as the middle of the Lake District. It's a really good job, but be prepared to put the work in.